Thanks, Rosemary, for the introduction. Hi, I am Seth Reno, President and CEO of Arkayli Biopharma. Our company is dedicated to delivering better therapies for pediatric vascular anomalies. Our experienced team is on a journey to change the way infantile hemangiomas are treated today. If you're asking, what is an infantile hemangioma? You probably have seen babies with a raised red birthmark, sometimes referred to as a strawberry birthmark. Hemangiomas are a vascular formation of blood vessels that grow on top or just below the surface of the skin. They have become the most common type of childhood tumor, and each year, 185,000 babies are born in the US with them. At first, the hemangiomas may look small, but in a matter of weeks, they can grow rapidly and cause permanent scarring and tissue damage, especially if located around the eyes, ears, or mouth. In fact, infantile hemangiomas have become the leading cause of preventable childhood disfigurement. There is only one approved therapy to date for IH, an oral beta blocker, propranolol, that's dosed 2 to 3 times a day. Timolol eye drops are also prescribed off-label, which are a beta blocker eye drop designed for adults, and they need to be applied 2 to 3 times a day. Both forms of these medications result in systemic absorption of beta blocker in very young infants that can result and unnerving side effects. The side effects parents may experience with their babies are cold extremities, sleep disturbances, hypoglycemia, seizures, or bronchospasm, all of which are very unsettling. The treatment duration can range from 6 months to a year and a half. As a result, many primary care physicians do not treat immediately and refer to pediatric dermatologists, which may take months to get an appointment. Arkayli is developing a topical solution that is designed for sensitive skin and is applied to the hemangioma once a day and can be simply washed off with soap and water. It's not systemically absorbed, which can eliminate the cascade of unnecessary side effects. Pediatricians and parents will feel confident treating their infants' hemangiomas early with a formulation that is safe and does not have systemic absorption of a beta blocker. Out of the 185,000 infants born each year, more than half of them will need early intervention to prevent complications and scarring. 12% of them, or 12% of the cases, will develop into severe complications, like the pictures you saw on slide 3. As I mentioned before, pediatricians can be hesitant to treat IH early due to the risk-benefit of current options and refer to pediatric dermatologists, which can take months to get an appointment. As a result, only about 28% of the infants receive treatment currently. At Arkayli, we believe a safer and more convenient alternative will encourage treatment on day 1. Looking at the patient funnel with 185,000 infants born each year, as I mentioned before, a little bit over half, 55%, will need to be treated. Another 10% will still need to have oral therapy. And this leaves approximately 92,000 infants that can be treated with a topical each year. We have developed a quantifiable endpoint measurement using advanced photography technology. Years ago, the assessment was conducted by individual healthcare providers, which can result in significant variances. Infantile hemangiomas qualify as a pediatric orphan disease and will utilize the 505(b)(2) pathway, which provides 7.5 years of regulatory exclusivity. In addition, Arkayli has filed a patent family that is currently pending. We have a very experienced team that has an extensive experience in pediatric dermatology drug development. The Arkayli team is well-rounded with expertise in toxicology, commercial development, CMC formulation, and over 3 decades in experience of treating infants with IH. The team has designed a very efficient R&D program to get through proof of concept phase 1 study. We are currently raising $1 million through a simple safe note. It comes with a 20% discount and a $10 million pre-valuation cap. We have currently started the program. The first $500,000 of funding will enable several important milestones: the submission of the orphan designation document to the FDA, a proof of concept mini pig study, scaling of the drug formulation, and a pre-IND meeting with the FDA. We have also received a grant from the University of Wisconsin. These milestones will create a significant value inflection point to launch a Series A round within approximately 12 to 14 months. Join us at Arkayli to change the paradigm in treating IH on day one, reducing the #1 cause of preventable childhood disfigurement. Thank you.